How do environmental toxins affect reproductive health? Have you ever wondered how the environment around you might impact your chances of starting a family? Environmental toxins are substances that can disrupt the normal functioning of the reproductive system in both women and men. These toxins come from various sources, including chemicals found in plastics, pesticides, heavy metals, and air pollutants. Understanding their effects is essential, especially when preparing for pregnancy. Many environmental toxins act as endocrine disruptors. This means they can interfere with hormone systems that regulate reproductive processes. For women, exposure to these chemicals can lead to issues like ovarian dysfunction and irregular menstrual cycles. It can also increase the risk of miscarriage and earlier menopause. For men, these toxins can reduce sperm quality and even cause DNA damage in sperm. Specific chemicals, such as bisphenol A, are commonly found in plastics and food containers. Research has shown that bisphenol A can impair egg quality and disrupt embryo development. Phthalates, another group of chemicals found in many plastics, have been linked to reduced numbers of mature eggs in women undergoing fertility treatments. Other toxins, like polychlorinated biphenyls, have been associated with longer times to conceive and lower fertilization rates. The impact of environmental toxins doesn't stop at fertility. They can also affect pregnancy outcomes. Exposure to these substances has been linked to increased risks of infertility, miscarriage, preterm birth, and low birth weight. Some toxins can even cross the placenta, potentially exposing the developing fetus to harmful effects that may last into adulthood. When preparing for pregnancy, reducing exposure to environmental toxins should be a priority. Here are some practical lifestyle changes you can make. First, try to avoid plastics that contain harmful chemicals, especially when storing or preparing food. Opt for fresh or organic foods whenever possible to minimize pesticide intake. Next, be mindful of the personal care products you use. Many contain potentially toxic ingredients, so consider switching to safer alternatives. Improving indoor air quality is also essential. Ensure good ventilation and avoid exposure to tobacco smoke and heavy air pollution. Consulting healthcare providers about environmental risks is a smart move, especially if you live or work in areas with known chemical exposures. Proper nutrition and taking prenatal vitamins can further support reproductive health and help mitigate some risks associated with environmental toxins. In summary, environmental toxins can disrupt hormonal balance and negatively affect both fertility and pregnancy outcomes. Taking steps to limit exposure before conception and during pregnancy is an important part of preparing for a healthy pregnancy. By making informed lifestyle choices, you can support your reproductive health and the well-being of future generations.